Elsevier MEDai has always been customer-focused, open to suggestion, open to improvement, and willing to get things done. Well, Novant has really been in a partnership with Elsevier MEDai for over 10 years. And we first selected Elsevier MEDai because at that time there really wasn't a clinical performance improvement tool that we could use. So the MEDai tool, the early pinpoint quality tool, was one that we quickly latched onto because of its clinical impact and because it was a benchmarked, severity-adjusted tool that we could use to better our performance for our patients. The key advantage was this was a tool that physicians could understand easily. It tried to make the apples-to-apples comparison with the severity adjustment so that no one physician could say, my patients are sicker. And it had a large enough client base. When we needed to make improvements, we needed more data on the how and the why, not just the what. What can I improve sometimes is easy. My length of stay is long, it needs to be shorter. But when I would go to a physician and say, your length of stay is long, it needs to be shorter, they would say to me, well, how? Help me understand, what is it about my care that makes it so much longer than someone else's? What can you show me? What can you do for me? So the clinical impact of the indicators that are within the tool set for MEDai really helped us bring it home at a practice level for the physicians in the type of things that they might be able to impact to change the metric that we had trying to work on. Novant Health and Elsevier MEDai have had a long-standing relationship. One of our senior medical leaders a few years ago said, gosh, this is a great AI engine. It really can help us predict things. What if it did it on the front end for our patients when they came in? What if we could find the high-risk patients who are at most risk for having trouble, either mortality or long length of stay or being transferred to the ICU? And what if we could predict that and intercede? And so over the last few years, I've had the privilege of partnering with MEDai and working with them to develop the Pinpoint Review product. So we really have looked at that Elsevier MEDai relationship as both a benefit to us because of the tools that we can use, but also the opportunities to try and create something even better. We want patients to come in, be attended to, and be discharged without incident. And having a strong clinical tool is one way to do that.